Have you ever wondered what actually shortens life after 75? And more importantly, what you can still control? Because the truth is, most people think aging is just natural decline. But in reality, many of the most common causes of death after 75 are partly preventable, or at least manageable with the right habits. And today, we're going to break them down, clearly, honestly, and based on real medical understanding, along with simple ways to reduce your risk. This video isn't about fear. It's about awareness and smart choices, because even small changes done consistently can make a meaningful difference in both how long you live and how well you live. Let's start with one of the most important. 1. Heart disease, still the leading cause. Heart disease remains one of the most common causes of death after 75. As we age, arteries naturally stiffen, and years of lifestyle habits begin to show their effects. High blood pressure, cholesterol, and inflammation all play a role, but here's the important part. Risk can still be reduced. Staying physically active, even with simple daily walks, helps keep the heart strong. Managing blood pressure, reducing processed foods, and maintaining regular medical checkups can significantly lower risk. Even later in life, the heart responds positively to better habits. 2. Cancer. Risk increases with age. Cancer. Risk increases over time due to cumulative cellular damage. Common types after 75 include lung, colorectal, breast, and prostate cancer. While not all cancers are preventable, early detection plays a major role. Regular screenings, when recommended by your doctor, can catch issues earlier. Avoiding smoking, maintaining a healthy weight, and eating a balanced diet also support lower risk. It's not about eliminating risk completely. It's about improving your odds. 3. Respiratory diseases, especially chronic conditions. Chronic respiratory diseases like COPD can become more serious with age. Lung function naturally declines, and past exposures like smoking or pollution can have lasting effects. Protecting lung health means avoiding irritants, staying physically active, and keeping vaccinations up to date, especially for flu and pneumonia. Breathing may seem automatic, but lung health requires attention. 5. Stroke. Often sudden, sometimes preventable. Stroke risk increases due to changes in blood vessels and circulation. High blood pressure is one of the biggest contributors. Managing blood pressure, staying active, and recognizing early warning signs, like sudden weakness or speech difficulty, can make a critical difference. Fast action saves lives. 5. Alzheimer's disease and dementia. Cognitive decline is one of the most feared aspects of aging. Conditions like Alzheimer's disease affect memory, thinking, and independence. While there's no guaranteed prevention, research suggests that mental stimulation, social interaction, quality sleep, and physical activity may help support brain health. Keeping the brain engaged is just as important as keeping the body active. 6. Falls and related injuries. Falls are a major but often underestimated risk after 75. A simple fall can lead to fractures, hospitalization, and long-term complications. Improving balance, strengthening muscles, and making the home environment safer, like removing trip hazards, can greatly reduce risk. Sometimes prevention starts with small changes at home. 7. Diabetes complications. Type 2. Diabetes is common in older adults and can lead to serious complications if not managed properly. These include heart disease, kidney damage, and nerve issues. Monitoring blood sugar, following a balanced diet, and staying active are key. Even modest improvements in blood sugar control can have long-term benefits. 8. Kidney disease. Kidney function often declines with age, especially in those with high blood pressure or diabetes. Early stages may not show clear symptoms. Regular lab tests, proper hydration, and medication management can help protect kidney function. Awareness is critical because damage can progress quietly. 9. Infections, more dangerous with age. The immune system becomes less responsive over time. This makes infections like pneumonia, influenza, and even urinary tract infections more serious. Vaccinations, good hygiene, and early treatment are essential. What might seem minor at a younger age can become serious later in life. 10. Malnutrition and weight loss. Unintentional weight loss is a hidden risk in older adults. Reduced appetite, dental issues, or difficulty preparing meals can lead to poor nutrition. Ensuring adequate protein, vitamins, and hydration supports overall health and recovery. Nutrition is foundational at every age. 11. Depression and social isolation. Mental health has a direct impact on physical health. Loneliness and depression are linked to higher risks of illness and even mortality. Staying socially connected, whether through family, community, or hobbies, plays a powerful role in well-being. Health isn't just physical, it's emotional too. 12. Medication complications. Many older adults take multiple medications. This increases the risk of interactions, side effects, and complications. Regular medication reviews with a healthcare provider can help ensure safety and effectiveness. Sometimes less is more when managed properly.
13. Frailty and muscle loss. Loss of muscle mass, known as sarcopenia, can reduce strength, mobility, and resilience. This increases vulnerability to illness and injury. Strength training, even light resistance exercises, and adequate protein intake can help maintain muscle. Strength matters more than most people realize.
14. Dehydration, a silent risk. Older adults often feel less thirsty, increasing the risk of dehydration. Even mild dehydration can affect energy, cognition, and organ function. Drinking enough fluids throughout the day, especially water, is simple but essential. Sometimes the simplest habits are the most powerful. 15. High blood pressure, the silent risk factor. High blood pressure often has no obvious symptoms, which is why it's sometimes called a silent condition. Over time, uncontrolled blood pressure can damage blood vessels and increase the risk of heart disease, stroke, and kidney problems. The good news is that it's one of the most manageable risk factors. Regular monitoring, reducing excess salt intake, staying active, and following prescribed treatments can make a significant difference. Even small improvements in blood pressure can reduce long-term health risks. 16. Vision and hearing loss, indirect but serious impact. Vision and hearing loss may not seem life-threatening at first, but their impact can be significant. Reduced vision increases the risk of falls, while hearing loss is linked to social isolation and even cognitive decline. Regular eye and hearing checkups, proper use of glasses or hearing aids, and maintaining good lighting at home can improve safety and quality of life. Sometimes, preventing bigger problems starts with addressing smaller ones. 18. Chronic inflammation, the underlying driver. Chronic low-grade inflammation has been linked to many age-related conditions, including heart disease, diabetes, and cognitive decline. It often develops quietly over time due to factors like poor diet, inactivity, stress, and underlying conditions. Adopting anti-inflammatory habits, such as eating more whole foods, staying physically active, managing stress, and getting enough sleep, can help support overall health. It's not about eliminating inflammation completely, but keeping it in balance. Aging is part of life, but how you age is something you can influence. Small, consistent choices each day can protect your health, your independence, and your quality of life. If this video helped you, stay with us, because the next one might help you live not just longer, but better.